Good afternoon. Thank you for coming back. So this is the report from 4 breakout groups. The first one is the group on enabling technologies and advancing exposome, unless you change the order. The group was moderated by Rima Haber and Emily Calaber, and I just learned that the report will be delivered by Carlos. So you are the first, please.
All right, everybody. Just an FYI for the people that were in enabling technologies, this was a draft that I sent along, so it might have a few missing things, a few typos.
Hold on,
It's in there?
Is it in a different order?
Oh, there it is. I
It's
think
fine.
that's ours, yeah.
No.
Yeah, the first table that came up was ours.
Oh, it was yours.
Yeah,
Oh,
yep.
so it was in the
Yes,
right
this one,
order.
yeah, this one's ours.
Yeah. So, first, can I
Oh, yeah.
quickly? So first, we asked people. You want to do this one too? You can. Okay. No. Okay. We were. Every breakout group was also asked to just get a sense of what the sentiment was about the topic that they were breaking out on. So we used a Menti poll, where you can post a question or a challenge or something like that, and people put their first impression as words, and that's what people exactly what people did. And the first question in this enabling technologies breakout group was, what are the greatest opportunities in this area? So what comes to mind? And people just started buzzing, and unfortunately this is not live, but when you were in that room you could see live that things were changing, and this is a word cloud, so the boldest words, which are health and collaboration, are what got most votes, or most people typed in those types of words. So among the group, these were all the things that were input, but health, collaboration, real-time sensing, and funding were 4 of the main things that were seen as an opportunity in this field. Then we also asked the reverse sense, what are the challenges that we need to do and face with? And that was, for this group, enabling technologies, it was harmonization, funding, coordination, and standardization. So, and a lot of other things, but those were the ones that got the most votes for. So in that way, with this in mind, the groups picked 3 accomplishments that they delved out and worked through, and that's what you're going to present on, right? So, yeah, go ahead.
Alrighty, okay, can everybody hear me okay? Mic's probably too hot. So I'll just quickly go through our 3 sort of accomplishments slash focus, things that we focused on. So the first one that you can see in the blue column is thinking about, we see as an accomplishment, a comprehensive exposomics knowledge base, a way to kind of synthesize and bring everything together of what we know in what could be a user-friendly portal, right, which we see as one of the milestones, but also establishing, developing, and deploying semantic standards in terms of thinking about harmonization, things that everybody can use that are established by, kind of the entire consortium. One thing that we had as a milestone for all 3 columns was just, it's good to look forward into the future, but also an important milestone moving forward is to evaluate what do we have today. We don't have to start from scratch, and kind of giving sort of credit and space to the things that people have been working really hard on. So, but going back to this first column, so needs and requirements for this, right? We need to develop this user-friendly portal. Also, another theme that came up for all 3 of our accomplishments was that for everything that we do, things should be scalable, economical, actionable, and accessible globally, and also kind of working within sort of a commitment to open science and equity. And then I think my brain's scattered for the rest of them, but we need funding, we need to think about governance, and we need to think about sort of like reproducibility and how to submit things and a lot of other details. Some neat applications for the first one is maybe thinking about like a larger LLM related to the exposome, thinking about a larger sort of association model, and just thinking about this as a data source for other applications or things in the other column, and also research analytics, and also like an exposome disease atlas as well. And so, and just one thing that we hope is the impact of all of these things is hopefully that there are thousands of diverse users that can use these things, and also, of course, we want to promote healthy sort of environments across the globe. And so alongside this first accomplishment, also thinking about Exposomics Comprehensive Personal Monitoring Informatics Platform. We spent a lot of time chatting about the individual words there today. And so this would be something that, in order to accomplish this, we would need the development of technology, so things like wearables, maybe something along the lines of quantum sensing, satellites, chip-based sensors were something that people were really excited about, and not just the physical wearables, but also thinking about those wearables and how they turn to data, how those feed into models, and so people really like the Exposomics tricorder, which I don't know about, but I heard in our group. And so some applications, technology allows you to measure any sort of molecule here, but any sort of thing with no bias and at a very low cost. And again, similar sort of impacts as we had talked about for the other one. And so for our final one, slightly different. So just functional translational tools as we think of moving from one scale or one type of sort of element of sort of the process to another one. So, thinking about, again, evaluating what we have today, but also think of a computational platform that in different ways from what I've mentioned previously, connects this exposome to health outcomes, but also connects back to thinking about the exposome and what are the causes or sources for those elements as well. And so applications related to that is, maybe like an algorithm that there's a lot of stuff that we think about in sort of the either outdoor spaces or the external sort of environment, and think about how that might translate to internal or indoor sort of context. Multi-scale digital twins, thinking more about simulations at different scales, so going from the most macro to down to molecules and thinking about that. And also, obviously, linking environment to health and well-being, and being able to translate sort of single pollutants and how to kind of connect those to different sort of mixtures or cocktails of exposures. So with, one of the big impacts is improving overall health for people and population, and just providing recommendations for thinking more along the lines like precision medicine for individuals, specific diseases, specific contexts, whatnot. So with that, I guess I hand it off to the next group. Right?
So the next group is the Exposome, Big Data, and Artificial Intelligence. Yeah. Jira? Yeah.
Please, Arijit, come on up. Fantastic. So we have Arijit here from the Institute of Mathematical Sciences from Chennai, and we had a fantastic group. Very lucky to work with those individuals here. What I take particular pride in the sort of the opportunities that these individuals sought out collectively was the mix of innovation and practicality towards clinical impact in 3 areas. So I'm going to go out of order the columns here of, can we show our slides somewhere, or where are they? Here's the next slide here. Okay, so greatest opportunities in this area: understand complex etiology, more data sharing, standardization, cooperation, harmonization, increasing the health span, and I think a key focus on reproducibility. So how will we do that? I'll skip towards to this slide. So we'll start in the middle. So we would like to establish a working group, AI-focused working group, to enable standardization and curation of data. So, so let me just skip towards the impact, and I'll come back to the requirements here. So, here the impact is a continuous international support for the curation and development of databases to support AI-enabled exposomics and delivering our collective deliverables. So. So short to mid to longer term milestones include a workshop that evolved into a working group, figuring out operational policy, documentation, governance structure around data standardization, sharing, use, curation, standards for AI and its use. No, they wanna do it like this. Oh. And then you can Oh, thank you.
Yep.
Scroll down.
Oh no, it's going too far. Sorry, not that far exactly. Dang. I'm just going to stand in this one, and then you just go down.
Yeah, wait, it's down.
Yeah, now you see the impact, right?
No, this is someone.
Someone else's. Sorry, we jumped really big.
Sorry for being difficult. Let's
No
keep.
worries.
I'll keep going. I'll keep going
It's
here.
right. It's right. We'll make it happen.
All right. So then another critical component of what we
This is you
discussed,
guys.
another opportunity, is AI-enhanced harmonization and data integration.
go.
So I think all of you will appreciate how difficult it is to harmonize data, and we need to somehow leverage our existing data resources efficiently that we have collected, alongside of potentially measuring new epidemiological cohorts and conducting new experiments. So impact would be a catalog of data that can be used to further health research and to fuel the third aspect of what we talked about today, and that's delivering AI for integrating exposomics into the clinic. And there, the impact statement is that expanding health span and longevity, public health impacts, improve urban spaces, phase out hazardous chemicals. So here the milestones are models that are trained across populations for disease prediction, implementation of multiple clinical sites to get to interventions that matter and test their efficacy, commercially available exposomic technology and software that can be integrated into the clinic. Availability of high quality and harmonized global data. Here there's some synergies with the third opportunity I talked about in purple here, about when we talk about technologies that, the emerging technologies that are coming to bear with use of high throughput mass spectrometry. There is a need of integration across those to make it platform agnostic, such that we have ways of comparing them across the board, and that's a need and both a feature of this particular use case. And so I think the critical thing here is stitching together these approaches for both preventative medicine, discovering new exposures connected to disease, and ultimately implementing them at the bedside for clinical care and public health surveillance. REG, anything else would you like to add here?
I think there was a broad understanding that it has to be multidisciplinary and interdisciplinary, and there are challenges here. I mean, certain questions which came up, like predicting the effect of mixtures and the generation of data was also discussed. And also one of the points we really discussed is what are the low-hanging fruits for the near term. So we have certainly identified it, and we are going to refine this slide today a bit more and give it to the organizers a much better slide.
Yeah.
Thank you.
Sure.
Yeah. So, yeah, Jeanette.
I don't know where George is, but I want to get up. There you are. Okay, so we were the psychosocial, ethical, and societal implications and impact. For greatest opportunities, sharing was number one, but you can see things like expectation, social justice, environmental justice, human flourishing, legitimate representation. You can see all of the words had a lot of equal status, right? Equal size. For challenges, privacy, trust, access, funding, obviously, but also things like cultural understanding, entrenched power, transparency, legal barriers. This is just sort of a sprinkling of the things that we talked about. So for our different accomplishments, this is just some of the things that we talked about in our groups for near term, midterm, and long term. And this sort of translates into the next slide, so I'm just going to go straight there. We had three main sort of accomplishments. One was guiding principles for stakeholder participation and involvement. The second was a resilient and dynamic governance structure. And the third was a comprehensive, I'm going to keep inserting framework in there because I really like these three nouns, and multi-level sharing. And what you'll notice about all three is they're very structural, which I think when people came into our room was a little bit surprising. But what really came out of our conversation is that a lot of threats to ethics, a lot of threats to being able to have equity and to understand sort of social impacts happen at the structural level. And so really highlighted the need to start thinking about these things early on and not just once we have findings and results. So for the first with the guiding principles, a lot of those milestones that the group identified was identifying relevant stakeholders, drafting a code of conduct, and then having a kickoff meeting of the committee to draft that code of conduct. Some requirements were consultation and also regional application of guidance principles, this acknowledgement that things will have to be flexible and nimble depending upon context. How this could be applied were things like stakeholder involvement, data collection and use, and the impact would really be ethical and principled use of exposomics globally. For the resilient and dynamic governance structure, the milestones were establishing that structure, having some global agreements and buy-in, and then creating and implementing evaluation strategies. Needs or resources, representation, privacy. The applications really were to sustain and grow participation with international liaisons for advocacy, training, and communication. And the idea of what does success look like would really be a trusted, respected, functional decision-making body. And this really, I think, across all the groups, there was this common thread of like needing to understand governance in order to ensure ethical application. And finally, on the comprehensive and multi-level sharing, this group took a really broad view of sharing. So it's not just data, but sharing lots of different types of resources. So again, milestones were general principles, impact evaluation of the structure that would be needed for such sharing, and then really having smooth, seamless sharing would be a milestone to achieve. The needs and requirements were to learn lessons from previous initiatives, and also broad consent forms defining data usage and including core sets of elements like address, history, and occupation. The applications would be making sharing easier, faster, as well as ethically and legally sound. Then, when you have all of this sharing, you can develop global exposome and phenotype maps, and you could start finding or providing guidance for some of this unexpected findings that you might find. And the impact would be that, having ethical considerations around sharing leads to being able to understand exposomic drivers of human health, particularly with the sharing promoting the use of maps, and really for sharing to be easier, better, faster, and stronger. So thank you. And thank you to all the people in the data group.
So next up, Benedict, you want to do it? Global coordination and collaboration, research infrastructures as models.
Yeah, thank you. So Rule and me moderated the last breakout group, and we had the special task of covering two of the proposed pillars, namely the global coordination and collaboration and the research infrastructures. And as was mentioned in the morning session already, this is a good natural fit because research infrastructures inherently need to be long-term strategically oriented, and this is definitely what we need for bringing forward this Exposome initiative in the long term. So when thinking about the greatest opportunities, standardization was put forward, quantification, kitification, putting everything into some kind of kit or chip, whatever, and many other things. With the challenges, you see there was not real common denominator, but generally many challenges to overcome for our complex issues. When looking at the accomplishments, I'm trying to summarize a very fruitful discussion very briefly. So we talked about that by 2040 we should have achieved standardization workshops, defining reference ranges, translational, clinical and policy impact should be considered, consolidated data and methods at high quality, so including all these QC pipelines, the high importance of a global research infrastructure that can set kind of these standards and put forward harmonization and standardization, but also maybe some kind of centralized access procedures. There was the need for creating some community of practice, that people really get together, that there are common social platforms for doing that. The need for implementing social factors, not only environment, and we were discussing about the need for including marketing. Actually, we were discussing whether 1 million people should know about the exposome within a couple of years, or rather 1 billion. But we then concluded that 1 million would already be a great tool, so that we don't need to explain to everyone what we are working on and why we are traveling to the US. Good. With that, I would like to come forward to the 3 representative accomplishments that the group put forward. And the first one, actually, all of them are in a similar direction, and I'm not surprised that also in the big data group they had similar translational aspects, putting the exposome more into a clinical context and also into the prevention context. So the first accomplishment was the standardized testing and kits that can translate to clinic, home, but also to policy. We defined these different milestones, short, mid, and long term. An important thing was that it would be good to have something like an exposome kit or chip, whatever, and to start small, so to have this in the short term, starting with some exposures and then constantly updating it for the longer term vision for the next 15 years. And many other things. The needs include, of course, the governance, funding as always, and was very important to highlight that we need low cost, we need to be faster, better quality but lower cost, and convenient kits that can also be applied in the global south to make it more accessible. Yes, and then for the impact, of course, this besides these low-cost implementations, that we have shifts in the medical approach from being reactive to proactive, and focusing on prevention, of course, on democratization of health-based decision-making. We were discussing whether it should be the democratization of health care or health, because we don't want to need the healthcare in best case. And then we were discussing if it makes, probably this is what we put up here, to increase the global average health span for 20 years is too optimistic, but we reached agreement that we want to reduce, of course, the differences between countries, and we want to increase the years of healthy life globally. And then we also were discussing that it would make sense to have some lighthouse examples for diseases that can also be good in transporting our message to other stakeholders. The example we put forward here was to solving cardiovascular disease by decreasing this by 25% within the proposed time frame. But we also discussed it will be very important to have a generic framework that can be applied to any kind of chronic disease, whether it's a rare disease or it's a very common type of cancer, for example. Yes, and then a last point was to also integrate this into holistic precision medicine and prevention, and to make federated infrastructure efforts to make this accessible. So we talked about the need for some global or federated hub for exposome data that is accessible, as fair as possible. In the best case, one hub, the kind of one-stop shop where people really find the information and where it's delivered in an easy way. And another thing which is not mentioned here but that we discussed is that we need common language, we need easy language that also other people understand, and we need to come up with some good terminology that we can agree on. And I think that was a very short summary of a very fruitful discussion. So thank you for all the people in the group and you for listening.
Thank you very much to all 4 reporters, and thank you very much for all the people who contributed to this assessment. I must say I cheated and I visited a couple of rooms. I spent each of those 3 time periods in different groups because I was curious what is being discussed. And it was interesting that 3 that I visited touched upon exactly the same topics. And then when I saw the Menti results, they really confirmed that words like standardization, harmonization, collaboration, those were cross-cutting issues that were discussed in all three groups. There was one thing that surprised me, and maybe I missed something, but I haven't heard the word toxicology. And knowing how many toxicologists are in the audience, I wonder why. Because I know that the chemical exposome is only one part of the exposome, but I believe it is important. And if we want to assess the hazards and risks that are related to chemical exposures, I would expect that somewhere toxicology would pop up, and I haven't heard it also from the report, so that's one of my questions. Then I overheard some interesting comments. One of them was from Paolo Vines in the group on global collaboration, because as you know, one of their goals was to bring the exposome into the precision medicine and public health. And then Paolo asked the question whether it is the right time, whether we really want to put the goal of bringing it into the public health before we know it works, and what is really the exposome element that we need to bring into the public health. So I think it is a very nice goal, but it reminded me that we need to be critical. We really should not only sell the whole vision of the exposome, but really think twice what it means, because Paolo, and maybe he will want to comment on it later, also raised the question of increased costs and whether this is relevant for especially some, weaker economies. Then I've heard very interesting discussion about financing. That's again something that popped up from Menti a lot. And I've heard the questions like, are we creating tools for everybody? Who will pay for it? I tend to say yes, we should develop the tools and offer them to everybody. That's the principle of the open access infrastructure. But then the questions continued, like, what is the structure for this future project? How we will pay it? And I think those are also the questions for Thomas, and I believe that some of those discussions about future structure and collaboration and coordination will be discussed also tomorrow. And then one of the important suggestions was we should show some kind of good laboratory principle or the example of the success story. What is that we really want to showcase? It's time to show the proof that the whole exposome concept works. But then the most interesting, in the end, somebody said, we should teach 1 million people what is the exposome as a first step. And I think that this meeting was the first step to this goal. And if you all share your experience throughout your research projects, maybe we will reach at least this very first step. So thank you very much for your work. And we still have about 15 minutes to give the floor to the audience. So I would be very happy if you just get up, go to the microphones, and come up with more suggestions of what we missed or what we didn't talk about, and what do you think should be highlighted.
Yeah. And I gave the online audience the slides again, so that's why they were flipping in the back.
I see.
But if you want me to go to a specific slide and you wanted to comment on something, let me know.
I see the first question up here.
Yeah.
Yes, a very quick question. Ana Navas from Columbia University. My question is, you mentioned toxicology, and that was surprising. What about epidemiology? Did you hear about epidemiology? Because that's also super important to think about the epidemiological methods and making sure we do these things right.
Yeah.
Any one of you? Those are basically the questions for you.
Well, I can say that we mentioned the cohorts in our group, and that this is, of course, very, very important and crucial to work together with them and not to reinvent the wheel and say we want to create new cohorts, but work on existing historic cohorts, acknowledge the work and effort that has been put into that, and capitalize as much as possible but definitely it's very, very important.
I think it is partially covered under this harmonization, because we should really speak about harmonized methods that we want to use in the future research, and it should cover all of them. I see Beate over there. Definitely she will have some comment on toxicology.
Absolutely. I mean, that was basically a call to us few toxicologists, and I think we talked about that, and there's a little bit of confusion, you know, on which side the toxicology sits, on the exposome side, on the other side, and I advocate very much, and I tested that on several people, but it never made it into the tables, was this idea of risk-scaled concentrations. So when we're going from non-target analysis data that are peaks, and we're just about, it looks like, to convert that to concentrations with these new models that have really advanced. So we're not there yet, but let's see, we should be there in 1 or 2 years. But then we still have just concentrations, and a lot of the chemicals do no harm. Others are very potent. And so we have to kind of scale the concentrations by their potency. And I think then we have toxicity integrated in that exposome idea. And the nice thing about that is we can check if these models work by actually running in vitro bioassays with complex mixtures, because that's what we've been doing for decades. And so I think there lies a lot of potential into integrating that technology, making that one of the cornerstones. It's not about chemicals, it's about their potency. And with this, you can also include other factors than just kind of pollutants, but also the chemical milieu that's been changed by some sort of external factors, lifestyle factors, environment, etc. So I'm pretty optimistic, and I talked with, the whole day I talked about toxicology, I felt. But now that you say it, yes, it didn't make it into this questionnaire, but it's just partially because, yeah, it didn't really offer those opportunities, right?
You were only picking 3 topics, so maybe it is hidden.
Yeah, you weren't in my group, that's it, in our room.
Anyone from you, any reaction to this?
I can just briefly mention, because the slide is still up, that it's very small, but it says polyexposomic risk score. So it was also mentioned to some extent in our group, and yeah.
Make sure it makes it up the list at some point. I'm asking also because we are having these discussions within IRENE, discussing, you know, what are the key elements where we need to develop enough service capacities. And again, in the toxicology, we don't really have the clear answer which services are needed to advance the whole exposome concept. Okay, next question.
So I am a toxicologist, so I'd like to take a crack at that, because I thought I heard that people said dose makes the poison very early on in the conference. So that was one thing, and that is at the cornerstone for toxicology on that. And so for a lot of us, when we were talking about collecting all this information, the elephant in the room is, well, do we need to collect all of it, or do we need to collect the information around the response levels that we feel are a problem? And so we started the conference out with the wild diagram and the discussion, but remember that talked about various assessments done across levels of biological complexity and across different life stages. So those levels of biological complexity include the responses in vitro, looking across SAR, looking at the response in organisms, and then how you transplant to humans. Well, that mechanistic part is at least claimed partially by toxicology. So we never reduced back down to that, but it is an inherent part in the wild, throwing back to us about that. So I was always surprised we didn't talk about the work that's done on exposomic, looking at aggregate exposure pathways and adverse outcome pathways that lead to disease. And that's where the mechanistic information comes forward. So maybe it is really missing on that, but I'm sad to hear that people were not catching it in that way. Also, polyexposomic risk scores are, there's no, it's almost an oxymoron, because risk equals hazard times exposure. So when you have polyexposomic risk scores, does that mean that the hazard is there already?
I really didn't want to
Okay, but I'm
initiate a
telling you
big
that
discussion of toxicology. It was just one of the things that I noticed. Thank you very much. I see Paolo.
Yeah. Well, I just want to make a couple of points in relation to what you said, my comments in the group. First, I think we have to be very clear about the distinction between clinical medicine and prevention, precision medicine, precision prevention. Because my point is that prevention is essentially at the population level. The most effective strategy against tobacco has been taxation. So, which doesn't mean that we shouldn't also integrate at the individual level. We have to do that, but we need demonstration projects. And this is the second point. That is, we don't have yet good examples of the transfer of exposome practice and philosophy into either clinical medicine or prevention. And so my suggestion is that we should seriously think of some demonstration project which tries to connect the different layers of prevention that go from policy making down to the individual. All the layers are needed, but the integration is the real problem. So we have different actors like the general practitioner, and then policymakers and the individuals, and also subgroups in the communities. The real problem is integration, and a demonstration project nested perhaps in some of the cohorts could be a good idea that deals with both measurements, harmonization, collection of data, and also some proposal for intervention, preventive intervention, and the evaluation of its effectiveness.
Yeah, test beds for exposome, the Human Exposome Project have been proposed recently, so that's one of the ways that we could maybe get to that level, yeah.
Any reaction?
So I think I would like to come back to the toxicology and other questions. So there was some discussion on the sideline in the AI and the big data session that number one point is that I think exposome has exposomics has the potential that it encompasses many fields. So since time is short, we were focusing on a few broader questions. Like, I mean, as the mixture question is really which is bothering me, and I've been discussing on the sidelines with many people. So do we have a benchmark data where we know that a single chemical at this concentration causes this adverse effect, the second chemical this effect, and then we combine them, how we do? We need a benchmark data to start building an AI model to do that. But from cheminformatics, we know that there are these activity cliffs. QSAR doesn't work. Most of the admit free tools don't predict well. So that's one. So I think this is somehow subsumed that we will create a benchmark data that we will be highly predictive at the AI level for that. But it is understood. Number two, coming to the adverse outcome and few questions which were there. So I think integration is required. For example, the adverse outcome pathways have an issue that it is not a fair data set that is causing a problem. Number two, if you see, there is also a European-wide effort on building disease maps and going from disease map to physiological maps, and how to use network science in general and data science to link between exposures and adverse outcomes so that we don't go at the animal models but do in vitro and other testing. So how do we do organoid testing, and those kinds of pathways will really help. So I think it is subsumed again that to answer your question that...
You don't have to defend yourself.
Yeah, so I think we discussed that.
The provoking questions. I didn't want to draw all the attention
so
to
we discussed it on the sidelines, but I think it was sort of subsumed that it will be there in the harmonized
We have
maps.
someone waiting up there.
Sure. So in this concept of moonshot, inspired by all the details everyone has featured, I propose, how about 100 million data points?
That was one of the examples.
And it's a start, there's a finish. We would have to challenge ourselves to create a global network for it that was equitable.
What is the data point?
So we would have to define as a body. So data point meaning person. So capture phenotype.
Everything about one person.
No, I'm saying, so what was our goal is how do we describe phenotype in terms of genome and exposome? So if we can collect a 1 million person database based on these synthesized, synergized, standardized ideas.
Is $1 million enough? Or do we need more?
But this is what I've heard a couple of times already.
Yeah.
Let's build the capacity for million internal exposures, external exposures, but the million is a nice word. Your reaction?
I'm afraid to say no, but yeah, so I would say this from the ethical stance. The thing that came out a lot, again, was the idea of you're going to collect 1 million people, so then how do you choose those 1 million people? And how do you think about how resources are allocated? So this need for guiding principles, a need for governance, a need to sort of describe, is there a hierarchical structure? Is there a horizontal structure to this moonshot? Like, what are these things? Because again, the threats to ethics, the threats to social involvement, to true collaboration are always structural. Like, we know this. So building it in early in the structure are the kind of the questions we need to answer, I think, before we can do. And I'm definitely a person of like, I do not want to go to any more meetings. I want to do. But this is an area where, you know, if I have, 9 hours to chop down a tree, I spend 8.5 hours sharpening my axe. It's this idea of like, what is the structure? What are the principles? And then that would make it, the implementation probably fair in both fair, findable data science way and fair in an ethical sort of way.
Thank you. Over here.
So maybe, Alice Limonciel from Biocrates. Maybe before the point I wanted to make, just a quick point on the previous question. I would actually go with no as well. That if this is also an opportunity to use the data that already exists and build on that, and then make the standardized approach that we want to make maybe a smaller cohort and then expand with the other existing data.
I don't think that
together.
she necessarily meant that we need to collect 1 million new people, but we have the projects like 1 million human genomes, so if we can complement it.
Okay, thank you. But the point I wanted to make, because I haven't seen it permeate very much in the discussion, so I wanted to make sure it's on the record somewhere. So we're going to build like a giant mass of exposome data points, like a lot of information, details, and they can be different for different people, but a lot of information that gives us a very high resolution picture of someone's exposures. And what I'm afraid of is that we go and compare that to a relatively simple description of their disease if we take the existing clinical data points that exist. And also taking advantage of the data that already exists, we should use cohorts that already have omic data incorporated, so that the disease is not just, you know, diagnosis or no diagnosis, it's also like a much more refined picture of it, and then combine that with the high resolution picture of the exposome together to have like a kind of matching level of complexity and build subgroups that really are linked to different exposures that lead to the same phenotype that you see at the end in the clinics.
Yeah, I would say that we are not here talking about one single point of certain diagnosis, but more looking at the long-term development of the human health.
Yeah, but so you might, let's say 15 years from now, you might have developed a certain disease, but like some people will have that from one type of exposure and others from different type of exposure. And this you can see already in the existing cohorts with all the different omics that have been measured, and then use that rather than the end descriptor. That's all I want.
So now you defend yourself.
It's not an attack at all.
It's thank you very much. It's very good that the voice of industry is also heard here, because this is what we were hoping, that we will also have people from the private sector. So I'm happy that you are here.
Yeah, and just to comment on that, so I think you're completely right that defining disease in a much better and more precise way is very important. So we just put together a review on breast cancer, for example, and it's unbelievable. People talk about breast cancer like it's one disease, but there are so many different forms, and it will impact how different exposures are acting. So I can agree on that, but I also think there are many resources that we can already capitalize on. Yeah.
Absolutely.
Thank you. I think we have time for the last two questions. So I have one here and one up there.
Thank you. My background is toxicology, so I have some comment on what you said. And because your comment was evokes some of my response. And I think you mentioned the lack of the toxicology mentioned in the final report. But I think the toxicologist can be the producer of the exposome. At the same time, the toxicologist can be the user of the exposome. I think that this applies for the. Do you understand what?
Are they? Do you think that toxicologists are just users of the exposome?
No, I said the producer as well as the user. So I think that when you think about what kind of items should be included in the exposome list, then you are using the result of the toxicology, of course. But at the same time, and after for example, that exposome list has been completed, it never completed, but anyway, once it's established, then the toxicologist can use that kind of the information.
It definitely creates a demand for more toxicological.
So I think that the same things applied for the epidemiologist. So anyway, if you think about this, then we need to think about the boundary of the exposomes. Because you can take anything into the exposome in principle, but then you need to expel something. So I think the boundary issue is very important when you consider what the exposome should be.
What do you think, our panelists? Where are the boundaries of exposome?
Or other people in the audience? Well, I think this leads us to maybe posting the last question because we're hitting time here.
I'm a great guy to ask this question. I'm a material scientist, and I work in industry. So, with the original Moonshot project, we went to the moon, and for every dollar we spent, something like $5 in economic value was created. And in these trying times where do-gooders are not rewarded, let's just put it that way, how do we justify the spending that we're talking about? How do we justify the open boundary condition that was just pointed out in our canvassing of the exposome? And I'm just curious how this project can set boundaries and expectations around that now, early, so it's not at risk of being cut off like the Apollo missions.
Great, thank you very much. And this is not going to be voluntary. I'll ask each of you to answer this question. How would you support your case?
Some of us had a discussion today in the morning, at least Chirag, me, and Shai Shenor. So I think one should not just think of exposome as negatives, but also what we should remove out of the exposome, chemicals or something, but what we can add to the exposome for better health. And I think when we are pitching to the government and funding agencies, that could be a big pitch. For example, in India, there is a lot of traditional diet. We are going away from that, and because we are living in a certain locality, geographical location, we are used to a certain environment. If we are going away from that, we may be losing our immunity. So I think exposome should not be seen only as negative, but the positive aspects of the exposome needs to be evaluated and emphasized. For example, good diet, for example. That could be a very important, that's not very expensive to do. You're just asking for a behavioral change, and that leads to a better health.
Someone else? Ben?
Yeah, so thank you for the question. Actually, it was really good having you on our group, so it was very intensive discussion.
Getting 1 million people to understand by the way.
No, and I understand the question from an industry perspective, but I actually would reverse it and ask, how can we afford not to use the technology and the knowledge we have nowadays to make sure that we can age in a more healthy way? How can we afford not to also make it available to people that are not in as affluent countries as most of us are? So I would also put this social component here, and I know there's a big difference between Europe and the US, but in Europe, where we have the social security systems, they will crash in some years, or latest maybe in 1-2 decades. So that's one of the main arguments we can put forward there. Probably it doesn't work in the US, but I think in Europe in the long term we definitely need this. Otherwise there will be a big crisis within the community.
Thank you. Carlos, please.
Yeah, so one thing, I don't know if I communicated when I was summarizing what we talked about, but something that came up a lot in our group was thinking about whatever solutions or accomplishments we thought about being actionable, implementable, and relevant to people. And so I think that's one way where, in terms of thinking about, creating or enabling different kind of technologies, it's not just sort of finding answers, but also providing sort of the means for other people to be able to explore their answers and what that might mean. I mean, a different way of thinking about it may be that we can focus, instead of thinking about 1 million sort of data points, right, in sort of that extractive way, is like, can we find, like, are the tools that we're using able to be used by millions of people? Like, are there people that can sort of learn about the exposome and be able to apply these different, whether it's a knowledge base or whether it's a different kind of tool, can they implement that everywhere to be able to show that whatever small thing that can happen can be implementable at a larger scale?
Thank you. And the final?
Yeah, I'll be quick. I'm not going to repeat what anyone else said. I think from the ethical, legal, social perspective, one of the things that came up a lot in that room was that there's not necessarily going to be a one-size solution or a one-size sell to all of the different governments, to all of the different localities. And the need for sort of cultural understanding and contextual understanding to say, what is the argument that works in this place? What are the needs that works in this place is something that needs to be sort of worked out earlier, so that way you can make the correct or the argument that will have the most potential for benefit.
Yeah, you have to localize the value proposition, basically.
Yeah.
Thank you very much. Fenna, do you want to close the session?
Yeah. So this was just a snapshot. This was a short, relatively short meeting in a sense of the whole lifespan if we turn 150. So there are many more accomplishments that we may not have captured. Feel free to use the templates that we provided if you have access to those folders to add more, or just throw out concepts that we haven't covered in your break, that you didn't hear in your group and that should have been addressed but didn't have the time for. Those, the OneDrive will stay open a few days after the meeting so that people can post their notes or their afterthoughts. But we really wanted to capture this, and I think we did a great job. So with that, and the moderators for reporting back all that information.